So, under the chapter coagulation, we will see the basic one liners. 1. Activated partial thromboplastin time aPTT measures the intrinsic pathway, PT prothrombin time measures the extrinsic pathway, and thrombin time measures the common pathway. Heparin is a dash, and most often the choices will be strong acid, strong base, weak acid, weak base. This was asked in my INASS entrance exam also. So the answer is heparin is a strong biological acid which is negatively charged at physiological pH. What is the gold standard test for heparin induced thrombocytopenia? Although there are many tests like platelet count and heparin induced platelet activation assays, the gold standard test is the functional platelet analysis, that is heparin induced serotonin release assay. So, what is the source of commercially prepared protamine? The source is fish sperm. The normal values of TEG you should remember. And the most common question asked is what is the normal value of maximum amplitude in a TEG? The answer is 50 to 70 mm. And this was asked in my NEET-SS exam. Rat tail appearance in a TEG denotes dash. That is fibrinolysis after you give streptokinase, urokinase or TPA. So if a patient is having microvascular bleeding, you can give cryoprecipitate or fibrinogen concentrate till which value of fibrinogen? That is, what is the transfusion trigger of cryoprecipitate or fibrinogen precipitate? The answer is the normal value of fibrinogen assay is 250 to 500 milligram per deciliter, but the transfusion trigger is fibrinogen more than 150 milligram per deciliter, and this question is often asked in INASS. Prophylactic low molecular weight heparin should be started 12 hours before surgery, and fondaparinux should be stopped 24 hours prior to surgery. In case of heparin induced thrombocytopenia, if you can't use heparin, then what use? You can use Onkrot, but that is not used now, or you can use low molecular weight heparin, but you have to test prior. So the golden answer for this question is alternative thrombin inhibitor, that is bivalirudin. There are also other alternative thrombin inhibitors, that is one is bivalirudin, another is hirudin, another is orgotroban. So what is the target ACT for your cardiopulmonary bypass? The target ACT is more than 480 seconds, and usually the dose of heparin which we have to give, that is unfractionated heparin, is 4 mg per kg or 400 international units per kg.